In the mid 1970s, at the height of the Vietnam War, malaria was disseminating soldiers on both sides with more lives lost to this disease than to bullets. The standard treatments for malaria had become ineffective due to widespread resistance to existing drugs. In this situation, Chinese scientist Tu Yu, inspired by a line in an ancient Chinese text, embarked on a journey that would ultimately lead to the discovery of artemisinin, a drug derived from the sweet wormwood plant Artemisia annua. The importance of Tu's discovery is immense. Therapies developed from Tu's discovery are now the frontline treatments for malaria and have saved countless lives worldwide. I will review the history of Tu's research exploring the positive impacts on malaria treatment, followed by a discussion of the negative aspects. To start, we will go into the history of Chinese scientist Tu Yu. In the late 1960s, the Chinese government launched a secret military project known as Project 523 in order to find a cure for this drug resistant malaria. Tu, with expertise in both Chinese and Western medicine, joined this Project 523 in 1969 and led a research team. Examination of an ancient Chinese medical text, a handbook of prescriptions for emergencies, described a method of soaking and pressing sweet wormwood to extract its juice, suggesting the active ingredient might be damaged by high temperatures. So, Tu adapted the extraction process and resulted in a stable and highly effective extract that showed 100% inhibition against malaria parasites in the rodents and monkeys they tested. Then two colleagues then tested the extract on themselves before conducting successful clinical trials on 21 malaria patients. The results were remarkable, with all patients recovering and showing no parasites after treatment. So now that I've highlighted the history, I will talk about the positive impacts. Millions of lives were saved on this malaria treatment, revolutionizing an outcome of Tu discovery. The drug clears malaria parasites faster than any other drug known, and it's effective against drug resistant strains. Artemisinin offered a vital new treatment option for malaria, especially against strains that had become resistant to those existing drugs. So these therapies have significantly reduced malaria related deaths globally. Tu's work really demonstrated the value of traditional Chinese medicine in modern drug discovery and has encouraged so much research into its potential to treat various diseases beyond malaria. This research indicates that artemisinin may have therapeutic value in treating cancers, inflammatory diseases, and autoimmune disorders. So, Tu's discovery earned her the Nobel Peace Prize in Physiology and Medicine in 2015, bringing international recognition to her work and highlighting China's contributions to global health. So, now that I've talked about the positive impacts, I'm going to share a little bit about the negative impacts. That being the emergence of artemisinin resistance in some parts of the world, particularly in Southeast Asia, poses a significant threat to malaria control efforts. Factors contributing to resistance include slow parasite clearance and enhanced parasite survival, requiring constant monitoring of drug efficiency and research into new treatment strategies. Partial resistance does, however, pose a threat to long term malaria control efforts and the continued effectiveness of antihistamine based therapies. Their side effects, while generally well tolerated, can cause nausea, vomiting, dizziness, mild blood abnormalities. Allergic reactions are rare but serious effects. And the studies in animals suggest potential lethal effects, leading to recommendation to avoid use in the first trimester of pregnancy. Therefore, a careful deployment of existing treatments to prevent the erosion of artemisinin's effectiveness is necessary. Moving from the negative impacts on to a conclusion, Tu's work really was sparked by ancient Chinese wisdom in the face of this widespread drug resistant malaria, leading to the discovery of the artemisinin, revolutionizing malaria treatment and saving millions of lives. Her treatment her achievements not only provided a vital solution to a critical global health crisis, but also highlighted the immense potential of Chinese traditional medicine. However, the widespread use of artemisinin has not been without challenges. The emergence underscores the ongoing need for vigilance and continued research and development of new anti-malarial drugs and treatment strategies. Tu's legacy inspired further research into the therapeutic potential of natural products and promoted the integration of traditional knowledge with modern science. So, moving forward, its crucial global health initiatives focus on protecting the efficacy of existing drugs, developing new ones, and strengthening healthcare systems to ensure equitable access to life saving treatments. And these works cited are 2Y 2011, The Discovery of Artemisinin, and Gifts from Chinese Medicine, Nature Medicine. Thank you so much.